My amazing patient came to me after pregnancy. She had severe loose skin. You'll see it today. The skin was hanging down and it was hanging over her waist a little bit. She's a healthy woman who's not obese or anything like that, but she has extra skin. She thought that liposuction would help her, so me and her talked it through. We discussed different options. I discussed liposuction and tummy tuck. The reason I discussed tummy tuck is because one of her main issues is loose skin. Now when somebody has a lot of loose skin and all you do is lipo and you remove fat, it looks sometimes more deflated, empty, botched. They'll get irregularities, lumps, bumps, and divots. Now I love doing lipo. I do lipo all the time. The challenge is you can't do it in the wrong patient. So if I would have just offered her lipo, and I did talk to her about it, and I said it is an option, but I didn't recommend it. Why? Her main issue is loose skin from pregnancy. When you liposuction that, it doesn't look better. It looks more loose, more irregular, you get waviness, and you end up on botched. I don't want that. So, what did we do? I said we can do a tummy tuck. A tummy tuck is where we're gonna make an incision. I lipo with my tummy tuck, so you'll still get that benefit, and I'll remove skin. Now you will get a long scar with the tummy tuck. We're gonna do special treatments and do our best to have that scar heal nicely, but you do have a trade-off. So when you're doing these operations, oftentimes it's a trade-off. You're trading one for another. Now we're going to do our best to suture that scar in multiple layers. We're going to put deep fascia together. We're going to put deep dermis together. We're going to suture the skin very nicely to minimize the scarring, and we're going to do a scar protocol. The challenge is you have a scar now, but that scar replaces the loose skin. And our goal is to make sure the scar you get from my surgeries, we do our best to make sure it's thin, it's low, it hides with clothing, and the scar is worth the surgery. One more time. The scar has to be worth the surgery. I tell myself that. This patient on the table today is coming to me. I'm going to do something that isn't that desirable, create a scar, and I have to make sure the surgery I do and the result I get completely outweighs that one factor. Let's do it.